Hello, my name is Gabriel Bendfeldt, a third-year medical student.
And I'm Hani Chanbour, a postdoc research fellow at Vanderbilt Spine Outcomes Lab, which is a joint collaboration of the Neurosurgery and Orthopedic Department. We're both working under the mentorship of Dr. Scott Zuckerman. We thank the CNS for the opportunity to share our work.
Bilsky score an established grading scale for spinal column tumors, classifying them based on severity of spinal cord compression via T2-weighted MRIs. The impact of low-grade versus high-grade Bilsky score on patient outcomes remains relatively understudied. Therefore, we sought to compare Bilsky score 0 to 1 versus 2 to 3 with regards to preoperative characteristics, intraoperative variables, and postoperative outcomes.
This was a single-institution retrospective cohort study carried out over a 10-year period, including adult patients undergoing spine surgery for extradural Mets. Exclusion criteria were mainly patients who didn't receive a preoperative MRI. Outcomes were divided into functional scores as depicted by Karnofsky Performance Scale and Modified McCormick Scale, as well as survival and local recurrence. In the multivariable regression, we controlled for the basic demographics, tumor characteristics, disease burden, and whether the patient received radiation or chemotherapy.
Of 343 patients undergoing spine surgery for extradural Mets, 92 patients were Bilsky 0 to 1 and 251 patients were Bilsky 2 to 3. Bilsky 2 to 3 lesions were independently associated with worse postoperative KPS and MMS, as well as MMS at last follow-up. Moreover, having a Bilsky 2 to 3 lesion independently increased one-year mortality with no impact on overall survival or local recurrence.
Overall, these results support the conclusion that in metastatic extradural spinal lesions, high-grade compression as defined by Bilsky 2 to 3 may be associated with worsened postoperative long-term function and increased one-year mortality, with no apparent implication on local recurrence or overall survival.
Finally, we want to thank everyone working at the Neurosurgery and Orthopedic Spine Outcomes Lab for their phenomenal effort. To find out more about our study, please click on this link below to access the full article.